You are welcome to Claribel Health Hub. On the channel today, we'll be looking at HIV and AIDS. I don't know the kind of challenges you are going through today, but believe you me, 6 months from now, a year from now, 2 years from now, 5 years from now, these challenges will no more be challenges. Believe me. Because I was counting back a year too, and I realized that there were some things I was looking forward to achieve. To the glory of God, I have been able to do them. And I believe if you look back into your own life, you realize that truly there are some things you were also looking forward to, which were challenges for you a year ago, 2 years ago, 5 years ago. But coming now in this year, you will believe that there are no more challenges. My dear brother, my dear sister, my lovely viewer, remember, no matter the kind of challenge you are going through today, it will no more be a challenge a year from today, 2 years from now, and 5 years from now. They'll all be new chapters or lessons we've learned from, and then we pick up from there. You are welcome to our discussion today, and we'll be looking at HIV and AIDS. HIV and AIDS, yes, because they are two different things. HIV is a human immune deficiency virus that attacks the human immune system to cause a deficiency. That means that the human immune system is not able to work or do its functions as has been given it. The immune system, as created by God, is to help the body fend off some disease-causing agents. And most of them, like common cold, like a flu, the body is able to succumb and reduce them to the barest minimum, that sometimes diseases pass through our system and we individuals do not even see them. Unfortunately, when it comes to HIV, at the beginning or the early stages of the infection, the individual, you don't fall sick or anything. Nothing happens. It doesn't ring a bell. But 2 weeks onwards, the most common symptoms that comes up will be the common cold, glandular fever, flu-like symptoms. With glandular fever, you're getting something like swellings around your neck, in your groins, in your armpit, and some other points of the body. You may have what we call the common cold, runny nose, blocked nose, sometimes with sore throat, sometimes with fever or increased temperature. These are some early symptoms. It doesn't mean that if you have any of these things, you have HIV. But then it's a prompt that you could have been exposed to the virus. I would rather encourage you that if you have any of these symptoms in the recent past, do test for HIV. There is no one currently. Most of us are not immune to HIV, which means that as long as you are a human being living on the planet Earth, you are at a risk of getting HIV. As the virus enters your body, it gradually depletes the functions of the immune system. It enters the white blood cells, which are the major graduates or the major cells of the immune system. It attaches itself and breaks these cells down to recompose itself and to replicate or to give more copies of the virus. The more copies of the virus you're getting into your system, the more depletion you are going to get of your immune system. Thus, individuals living with HIV will get what usually the body would have been able to overcome them. But you realize that over time, if you were able to overcome your common cold in a week, with HIV infection, it can go about 2 weeks that you have a common cold. And when you get something like sore throat, it stays much longer. You can have severe cough, which can last more than a month. Sometimes, most individuals who have had the inoculation of tuberculosis may come down with tuberculosis. Why? Because as the immune system depletes, some of these dormant germs we may be having in our bodies becomes true infections. And treating them takes much longer than it would have taken in any other person who is not living with HIV. Thus, individuals living with HIV, if we don't seek treatment or management at these early stages, the infection progresses. HIV infections currently is of 4 main stages. We have stage 1, stage 2, stage 3, and stage 4. Most of the time, stage 3 and 4 are advanced stages of the infection. And that is the stage, usually stage 4. You say the individual is having or living with AIDS. AIDS is acquired immune deficiency syndrome. It's a syndrome because at this point, the individual will have multiple infections that takes much longer time to treat, and they need much more intense treatment than it would have been earlier. So it's true, there is no cure for HIV or AIDS. Scientifically, currently, we don't have any cure. But there is management of HIV. So as soon as you realize you are HIV positive, it is encouraged that you avail yourself for care. Why am I saying this? Because sometimes, some parts of the world, we have home testing kits. So the individual will go to a pharmacy or a drug shop, purchase the testing kit, go and do the test for him or herself at home, and that ends it. But the painful truth is, if you happen to be HIV positive and you don't link yourself to care, my dear, it takes about 8 to 15 years for you to advance to AIDS stage. However, as soon as you realize you are HIV positive and you avail yourself to care, you will live a healthy and normal life like any other person. And most of the time, you will have the lifelong time God has given you here on earth. Why don't you join me as we focus more on studying HIV and how we'll be able to overcome them? One, if we don't have them, we're looking at not getting them. If we're already infected, how do I make sure that I don't progress to AIDS stage? If I'm already living with AIDS, what can I do to help myself live a better and a more productive life? Today, we'll end our video here. I want you to subscribe to the channel, hit the like button, share the video with others as we delve further into HIV. Don't forget or hesitate to send us your comments, your questions, and your contributions in the comment sections. We'll be glad to share with our friends and families as well as we come back to you in our next episode, looking at the various stages of HIV, ways of overcoming the virus, and how we can live with or without HIV. Thank you for watching. See you in our next episode. I have been your hostess, Clarice. And from the team Claribel, we say bye-bye for now. See you in our next episode.